Hi, everybody. Stacy's here. Welcome, welcome to today's Community Cats and Coronavirus pop-up panel. Today, we're going to be focusing all on spay neuter. And we have some great guests with us today. I hope you're all having a good afternoon. Just for a couple of minutes here, you can go into the chat box and just let me know if you're hearing me and you're seeing me. Please let me know as my version of my technical check. And yep, okay, great, Mallory, thank you. If you'd like to introduce yourselves in the chat box, say, hi, my name is so-and-so and I am with so-and-so. I'm gonna do a quick poll. For those of you who know, I love my polls. I'm gonna do a quick poll just to get everybody in the mood while we wait for a few more people to sign in. So question is, where are you from? Are you from Eastern United States, Middle US, Western US, or outside of the United States? And we get to do your voting. And I am going to, I'm going to close the poll, share the results. So we've got 68% from Eastern United States, 10% from the middle part of the country, and then we get 20% over in Western United States, and 2% of outside of the United States. So thank you so much for joining us. I'm going to do one more quick poll. I have a couple of polls here. For this will help with the speakers. Is your spay neuter clinic doing surgeries operating as normal? Doing less surgeries with different protocols? And this is for folks that are involved with clinics. And if you know information about other clinics, feel free to vote for them. I don't think that they're gonna be mad. And the last choice is totally closed. All right. Excellent. I'm going to close the poll, share the results. So 5% are doing surgeries operating as normal. 34% are doing less surgeries with different protocols. And then we have 61% totally closed. All right. Excellent. I'm going to hide those results. And then what I think we were going to do at this point in time, I'm going to do one more quickie question. For those of you who are doing surgeries, what surgeries are you doing? Select one or more of the following. And you can obviously select more than one. So check all that apply, basically, if you were doing surgeries. That's great, and that's wonderful. We have 63 folks here attending today, so this is fantastic. Thank you so much for showing up on your Saturday afternoon. And I'm going to close this poll just to share the results. So what surgeries are you doing? You're doing neuters. 26% are doing neuters. 37% are doing spays. 45% doing emergency surgeries, and 42% nothing, totally closed. Excellent, excellent. All right, well, it's good to have this information, good to know what we have going on. I'm going to just take a quick look at the questions box and see. We have Mallory from Tampa, Rochelle from Pasadena. We have New York City, Bridget, Kathy, also from New York City, Julie Jacobson from Tennessee, Katie from the Pet Community Center in Nashville, Tennessee, and Jocelyn from Massachusetts. Tanya from Brooklyn, Amanda from Detroit, Jennifer from Honolulu, and Kelly from San Francisco. Those folks have introduced themselves. Sue DeMeo is also from Massachusetts. So thank you so much for virtually introducing yourselves. For those of you who are just signing in, welcome to the Community Cats and Coronavirus pop-up panel. We're just thrilled to have you here with us today. I am thrilled to have an incredible panel of speakers that want to share their thoughts around spaying and neutering and the coronavirus. So I'm going to just jump right into the presenters for the panelists, because I want to have enough time for questions and answers. Please feel free to put your questions in the questions box, and I'll collect them, and we'll do a Q&A section at the end. So we have Bryan Kortis with us today from Neighborhood Cats. We have Karen Little from Alley Cat Advocates, and we have Craig Nielsen from Spay Mexico. So we're going to get some great perspectives and ideas. So at this point in time, I'd like to ask Bryan to turn on his webcam, if he can do that. Bryan is the Director of National Programs for Neighborhood Cats. He's a frequent flyer here at the Community Cats Podcast. And so, Bryan, I'm just going to let you run away with the show.
Well, let's jump right in. And the first thing I want to talk about is where are we today as a field? And I think the polls that Stacy just did are pretty representative. We have a significant part of the country has completely shut down all spay-neuter services. And, the consequences of that are pretty clear. I mean, what we're seeing now are we're seeing intact cats and dogs and rabbits and any other animal that would normally be fixed. We're seeing them adopted out intact. We're seeing unaltered animals placed into foster homes. And we're also seeing stray dogs and community cats basically reproducing in front of our eyes outdoors. So what is this going to result in if this kind of spay-neuter shutdown that so much of the country is facing right now? What's going to come of that? And a lot of this is probably pretty clear to people, but just to emphasize, obviously we're going to see a surge in overpopulation. That's the most obvious thing. And of course, we know that as the outdoor population grows and to a significant degree, we're going to see more death, we're going to see more suffering among the animal population as food sources aren't adequate, or just the normal kitten mortality rate, for example. We're also going to see public health risks rising. So when it comes to stray dogs and more so community cats, they're given a vaccination for rabies at the time of surgery. If the surgeries aren't happening, the rabies vaccinations are not happening either. And we're basically going to have not just more animals on the landscape, we're going to have more unvaccinated animals on the landscape. Secondarily, not as significant a public health issue, but still an important one, is the nuisance behavior. And so we're going to have a lot more yowling cats and tomcats urinating, spraying in backyards, that kind of noxious odor. We're going to see more roaming, and we're going to see a lot more complaints. Unable to intervene in these situations, I would predict that there'll be an uptick in cruelty incidents as people become very frustrated with the situations in their areas and there's nowhere to turn for any help. Then that hostility is going to potentially boil over. We also have to recognize that there are parts of the country, especially impoverished, like Native American reservations, we have a severe problem with stray dog packs. And in these communities where there are puppies and there has been some TNR of the stray dog population going on, that's all going to come to a halt. Those packs are going to grow. They're going to have more unneutered animals among them. And it's going to take it what is already a dangerous situation and potentially make it much worse. Another consequence of this is pet owners who have who have not spayed or neutered their animals yet. Maybe they adopted them as kittens or puppies, and now they're coming into sexual maturity and they have nowhere to go. So what's going to happen when these animals start acting out in very natural ways? They start spraying to mark their territory. They start going into heat or yowling or whatever it may be. I would predict we're going to see a pretty dramatic increase in abandonment. And I know certainly where I am here in Maui, we've already been seeing signs of that. We've been seeing colonies that are 100% spayed and neutered all of a sudden have a bunch of new arrivals just within the last month. And then finally, a consequence of continuing to shut down spay neuter is sooner or later, we're going to, these animals are going to end up in the shelters. We're going to have, as it is, keeping the euthanasia rate down is a real challenge in just about everywhere. But now that we're going to add all this new excess population, I think it's inevitable that we're going to see euthanasia rates significantly rising. Obviously, that's a tragedy for the animals who lose their lives, but one thing that we often don't take into account is the research that shows that shelter staff that is directly and regularly involved with euthanizing animals, they suffer much higher rates than the rest of us. I shouldn't say the rest of us, but then the main population of, they suffer higher rates of mental illness, substance abuse, suicide, post-traumatic stress disorder, anxiety disorders. And we're going to be subjecting people to this if we continue on the road that we're on. So I don't think I'm exaggerating when I say that the situation is quite dire, that the damage that's being done is accumulating on a daily basis. And if this goes on, nobody knows how long this is going to go on for. There may be a miracle drug that's discovered tomorrow, and this all ends very quickly. Or it could be a situation with the pandemic that goes on for months. Some people say years. I don't know. But the potential for just complete and total disaster in the animal welfare world is quite present. So we're not in a very good place. And I think we have to ask ourselves, how did we get here? And this is just my take on it. But I think that one of the factors was just the shock that we all experienced at the pandemic's arrival in the United States. I think we were led to believe, obviously quite incorrectly, that everything was under control. We were told by the federal government, hey, there's 15 cases in this country. We're getting close to zero. It's not a big deal. We've got this under control. It's not going to happen. It was something that was happening far away in China, in parts of Europe, because, we thought, well, they don't have their act together like we do. And then boom, one day it arrived, and all of a sudden people are being rushed to the hospital, and since nobody has any immunity, the numbers are really quite staggering. People started going into ICU, people started dying, and a lot of the states reacted, I think, appropriately by putting in these, pretty drastic stay-at-home orders, shelter in place, trying to minimize social interaction. And the shock of that caused everybody, including the animal welfare field, to immediately go into like a bunker mentality, like we have to shut everything we can down because this is such a bad situation that we're in with the pandemic. That led to, I know at one spay neuter clinic where I've been involved in, the day after the governor issued a shutdown order, the clinic closed. It's just that was the reaction. Now, I think this kind of bunker mentality was exacerbated by our national animal welfare leaders, who basically came out with a very coordinated campaign to convince the rest of us, or basically tell the rest of us, that spay neuter is not an essential service, that if you are engaging in spay neuter, you are promoting social interaction and you're aiding the spread of the virus, and you're depriving the healthcare field of scarce personal protective equipment, the PPE. And that only if situations are life-threatening should veterinary care be offered to animals. And spay neuter certainly would not, in most cases, fall into that category. So the field mostly just followed along. Like, these are the experts, they have the influence, they know what they're talking about, so we should do what they say. Well, now that things, we're starting to adjust to this kind of new world that we're in for we don't know how long, I think it's a legitimate exercise to start asking, is this a good policy? Was that the correct path for the field to follow? And personally, I don't think so. My main point today is I think that you should decide for yourself. I don't think that I don't think we should just be bullied or told what the correct path is. I think we need to kind of analyze this and figure it out and look at our own circumstances and our own staff, our own community, and decide what is best for each of us. So the first thing in analyzing, is this good policy, is that question of, well, is spay neuter essential? And there's two aspects to this that often get confused. But the first one is a question of legality. So would it, if you decided, yeah, I want to start up spay neuter again at my clinic, would that be legal in your jurisdiction? And I don't have a chart that I haven't looked at every state's laws, because sometimes the public health rules come from the counties, sometimes they come from the states. But the ones I have looked at, I haven't seen one yet. Well, I've only seen one. I've seen one county where it specifically said spay neuter is not allowed. Most of the rest of them are silent on the issue. They say that veterinary care is essential, that animal care is essential, and then they leave it to the practitioners, the experts in the field, to decide what particular procedures are essential or not. So in New York State, for example, that's one of the few states I've seen where it specifically says that spay neuter is essential veterinary care and is allowed during this crisis. So if spay neuter is legal, which I believe it is in most places, then the decision on whether to pursue it is a matter of discretion. And how do you, as long as you're working within those legal boundaries, you can make up your own minds about it. Now, I think it's essential for all the reasons that I just discussed about all the consequences, all the public health risks, the overpopulation, the psychological stress to this shelter workers, to just going backwards as a field years and years. I think that it is essential. And essential, also keep in mind, essential is not just emergencies. It's not just things that, and I'm speaking legally, are not just things that directly assist in fighting the pandemic. So the example I like to use is here in Maui, the construction industry is considered essential. And that's because the housing supply here is so low and the public schools are so crowded that the culture has decided through the government that we need to continue to build this housing. We need to build these schools, even during the crisis, even during the pandemic, even though that probably increases the risk of spread. It's too important to stop. And what that shows you is that what is essential, as long as it's legally allowed, is a value judgment. And our leaders in the field have made a value judgment that spay neuter is not important enough to take on any risks that have to do with the virus. Now, that's entirely their right to have that opinion. I don't think it's their right to tell everybody else that they're wrong if they feel otherwise, and to stigmatize them, as has been happening, if they don't agree. So ultimately, the question to me becomes, can you do this safely? Can you minimize, can you maintain social distancing so that going to a spay neuter clinic is safer than going to the grocery store? And can you do this in a way where you're using minimal personal protection equipment? And I think what I've seen is many clinics some clinics never stop. And Karen can talk about that. And some are starting to come back on board because they feel like they can answer these questions. Yes, we can do this safely. We can do check-ins and pickups and payments without any social interaction at all. We can re-sterilize our surgical gloves. We can minimize the use of PPE to the point where it's not taking away from the general effort to fight the virus. And those are the things that that we need to learn more about. I think that's what we should be talking about as a field, is not whether we should be doing spay neuter, but how can we do it safely? What are the conditions under which it's acceptable? And then each clinic and shelter can decide for themselves whether or not they're comfortable with the procedures that they're able to follow. So my point is that when spay neuter is legal, which it is in most cases and that I've seen so far, it's a personal choice. It's up to your organization. It's up to you as a veterinarian. It's up to you as a veterinary technician, whether or not the mission, whether or not the risk is when you're balancing these two things, whether or not you want to go forward. And I respect your decision either way. If you decide, if you're in a situation you think, no, we can't do this in a way that's safe, we need to shut it down, I don't think there's anything wrong with that. But I don't think there's anything wrong if you say the opposite. You say, yes, we can do this in a way that's responsible. We can do this in a way that's safe. And we're going to move ahead because we don't want an explosion of cats and dogs and rabbits. We don't want to go backwards 10 years in our community. And, we have to understand that I think that, as I said, I feel like our national leaders, the ones who have really been pushing that, you're doing something wrong if you're pursuing spay neuter, and they've turned this into a moral issue instead of a practical one. They've misled us, and we need to understand that, and we need to start finding our own way in doing this. And you need to decide what's important. You need to decide whether you can do this safely and responsibly. And the last point that I would make is that I don't think the current situation is sustainable. When you hear from people who are fostering cats and they're coming into sexual maturity and they're having to deal with them spraying, or they're having to separate them, and then they're thinking like, well, I'm going to hold on to them no matter what. But if it's, this thing goes on for another 3 months, even if it opens up then, and there's this gigantic backlog of spay neuters, I may not get my foster cats fixed for another 2, 3, 4 months. And then they're going to be a lot less adoptable because they're much older. And then my space is going to be filled and I won't be able to foster other cats. And you can see the chain reaction, how it will filter through the entire animal welfare system, that we could be dealing with the consequences of this for years. So my final message is that I think we need to sort this out. We need to figure out, can we proceed in a safe and responsible manner in our particular situations? And we need to respect each other's choices and not turn this into you're a good person or a bad person, but respect each other's personal choices.
Karen Little is with Alley Cat Advocates out of Louisville, Kentucky. You are the executive director. And at this point in time, I'm going to share with you. Karen, just say hello, making sure your sound works okay.
Hey, is it working all right?
You're great. It's all for you.
All right, great. Thank you very much, Stacy. So yes, I am the co-founder with my husband of Alley Cat Advocates in Louisville, Kentucky. We started our TNR focused work in 1999 and have been doing so since that time. We have altered around 50,000 cats in our community and the surrounding counties. When this whole issue with coronavirus started raising its ugly head in March, it never occurred to me to shut down our spay neuter operation. We do our own spays and neuters out of our own facility that actually just opened up as a freestanding clinic in February. Good timing, bad timing. But it didn't occur to me that we were going to stop unless there were federal, state, or local mandates that spay neuter surgery should cease happening. And that did not come down the pike. We didn't have that from our federal government, our state government, or our local government. So for me, it was just a matter of, let's see how we can react to the realities that this puts us in. And We also looked, of course, to our board of veterinary examiners in the state to get direction from them, because we do want to be in compliance with their recommendations. And while their recommendations were to consider holding off for 30 days of spay neuters, it was just that. We would like you to consider that. And so we did, and decided to just move forward and meet the challenges that we were faced with rather than stopping our work. We had, because we had just opened, large part, did have a fair supply of all the equipment that we needed as far as PPE goes, but we also had all the drugs on board that we needed as well. So we really didn't have to change our supply acquisition at all. We were good and set and solid for at least 60 days, if not beyond that. What we did find was that there were fewer people who were interested in pursuing spay neuter, trap neuter return services, which makes complete sense. Everybody's distracted. They're concerned about their own families, their own jobs, their financial well-being. And as is not atypical, cats took somewhat of a back seat to the other concerns. But in the last few weeks, we've seen an uptick in calls to us asking about our services and wanting to get their free roaming, their stray, their community cats that they're watching now more than ever, because they're often at home, these wonderful caretakers. They're wanting to get them spayed and neutered and stop that reproduction that they're actually seeing happen in their backyards. So while we did see that downtick of calls, we are now seeing those calls increase. So we did have to back down our number of surgeries. Our goal was by April to be doing 150 community cats per week. We know that our community has that need. It's been demonstrated over the years, and we're only currently doing between 30 and 35 a week. But I do see that increasing in April quite significantly, likely doubling, and moving forward as people again become more comfortable with the new normal. That will be an increase that we need to meet. We did furlough our staff to reduce expenses. We will survive, I'm absolutely confident, but we did have to make strategic moves in that regard, and we will be bringing the staff back up as those numbers increase strategically. We did, of course, want to follow all CDC guidelines with regard to social distancing. And that was actually probably the easiest aspect of this whole strategic visioning that I was having to do as an executive director, in that we want people to feel comfortable as they come to us. And as Bryan alluded to, we could make it safer than going to the grocery store. Fortunately, this is a March-April situation at the current time, not the dead of winter in Kentucky. So we're able to do all of the checking in of cats, all the discharging of cats, all the picking up of traps and the returning the traps to us outside. We're able to have simple measures like, while we don't do online admission signing of paperwork, we do that on real paper. We can have a canister of pens that have been disinfected, and we hand that canister, we put that up to the citizen who's still in their car to pull out a clean pen. And when they've signed their admission paperwork, they put that pen in the canister, the cup, plastic cup that says dirty. And so we're able to eliminate or greatly reduce the possible contamination through the reuse of pens. We don't take credit cards. We have the citizen fill out a slip with their credit card information, so we don't have to handle their credit cards. All of this is done outside. We place 6 feet long tables parallel to one another so that no one can come closer to our staff, or nor can we come closer to the citizens than that 5 to 6 foot barrier. We have no one from the citizens come into our facility. It's all done in the parking lot. When the weather is inclement, we have a 10 by 10 foot tent that we set up. We take names as people come into the parking lot so that we're able to deal with them and their issues, whether it's checking in or discharging the cats, in the order in which they've come to see us. our staff do wear masks when they're outside dealing with the public, as has been increasingly becoming the norm. So those changes were actually extraordinarily simple in the whole scheme of things. And I feel that we are acting responsibly and safely in all regards to the admission process, the discharge, and the sharing of the traps from our trap bank. We have a small staff. We have 8 total. 3 are the clinic, the veterinarian, and 2 vet techs. And then we do use volunteers as part of our clinic staff. And we have kept those numbers to a very small number of volunteers. And some of that is self-policing by those volunteers, but otherwise it's volunteers who feel comfortable, are understanding of our need within the clinic setting to do the social distancing that we're requiring. It is not as perfect with regard to CDC guidelines as to space as we would like, but we're continuing on a daily basis to tweak how we can make sure that we're doing everything that we are doing as safely as possible. I mentioned the financial struggle. Again, I think that as a nonprofit organization, and we offer no-cost surgeries for our residents in Jefferson County, the huge majority of those 50,000 cats have been done through our organization at no cost. We will have challenges in just communicating to our supporters that we are business as usual. That seems to surprise people, but when we do communicate clearly, they're fully on board and continue to be supportive. We continue at every touch point to reach out to these caretakers who are bringing us cats, that we appreciate any donations that they can give us so that we can continue this work. We will need to ramp up the numbers based on not only the calls that we're getting for assistance, but also the revenue stream that's coming in. This is not a time for us to change our strategy and begin charging citizens for these surgeries. This is absolutely the opposite time to do that. So while we will struggle financially, I'm absolutely certain that the volume will increase over time as we all learn that the sky has certainly fallen for some citizens, those who have passed away and those families of those citizens. But for the huge majority of us, it has not. We have to adjust to a new normal, but we can do that. And all the downside of stopping these surgeries that Bryan has very well articulated are something that we want to avoid to the extent possible. And I feel that we're working responsibly and successfully and can mitigate some of those challenges as we move forward in the coming months. I don't think I have anything else to add, although obviously I'm going to be available for questions as we get to the end of our hour today. Thank you, Stacy.
Excellent. So this is Craig Nielsen from Spay Mexico. Feel free to introduce yourself and share what you're going through these days.
Well, I've been on the phone. I got this call a couple of days ago from Stacy to would I like to talk about what's been going on, and answer is yes. The one thing I will do is just a little bit about who I am and where I am. I live in San Diego County, in North San Diego County, right across the border from Tijuana. And years ago, we got involved in working down there because there was a pandemic going on there, basically called pet overpopulation. And what happened is I began to see this problem down there as, you know, real like Bryan and Karen say, you know, it's everybody's problem. You know, at that time, Katrina was happening and all the people were rushing down to that region. And my friend called me and says, Craig, you got to come down here and help us. And I said, well, I got a pandemic happening in, you know, Tijuana, right across the border. So we started focusing down there in about 2003, I think it was, somewhere around there. And the bottom line is, just to kind of fast forward, we used to go around and do these big campaigns. We got Dr. Marvin Mackey, who's kind of he's kind of the, we in our level, we think he's kind of the king of spay neuter. He and Dr. Jeff Young have been expanding the whole idea of spay neuter for many years, and very close friends, and we have worked together for many years to try to get something happening in Mexico. And so what we've done is a few milestones is we've crested over 100,000 surgeries reported. That's not anything to do with the amount of vets that we've trained. We've trained many, many vets. About 2 years ago, we certified a high quality, high speed spay neuter training course by ConserVet. It's an actual certified course that veterinarians come in and take this course. We had our first one last year in Mexicali. We trained 18 veterinarians, and then we just got back in February from Dr. Jeff Young's Planned Parenthood International Center down just south of Cancun. We trained another 13 vets there, and we added 5 new trainers. We trained vets from Costa Rica and Spay Panama and around Mexico. So we've went from just giving spay neuter away in these huge campaigns to trying to make it sustainable by creating, like I say, a high-speed, certified, quality, nobody dies surgery campaign. And it's been an evolution for many years for us to get to this level. And just to bring it full to this moment, when this pandemic thing started happening, we were on the verge of just canceling our training down in Cancun because there was, I think, 6 people in California and 13 in the United States. And we said, well, let's just go, because they weren't reporting any at all in Mexico. And so we just went, and we had about 45 people show up down there from 6 different countries. And anyway, we came back, and so far as we know, nobody spread it. But going forward, what's happening now is there's a complete shutdown, pretty much. I mean, some emergencies are being taken care of course, but in Mexico, there's kind of like along the border here, for example, there's a red zone, which means people from Tecate can't go to Ensenada. People from Tijuana can't go to Rosarito. People from Hermosillo can't go to, Puente Peñasco. So there's a kind of a shutdown. Not only has that affected the clinics, nobody can get any supplies. No anesthesia moves, no gloves. An N95 mask down there is $15, and they're struggling for that. Dr. Blyra, I just was on the phone with her in Hermosillo. Her sister is a medical doctor, and she is seeing 40 coronavirus patients a day in that hospital. And Blyra gave her all her masks and gloves for the hospital. She's been wearing her one N95 mask for the last 10 days, and they're freaking out because she loves her sister and they just cannot get anything. So when we think the United States is having a problem, in Mexico and Latin America, it's just a really big problem because they do not have they don't have the ability to get these materials. If I could get them, how am I going to get some to them? See, I can't. We just sent Esther Meckler. Some of you may know her. She was with Spay USA for many years, and she has Marion's Dream now. And she just went down to Peru, and we sent a bunch of supplies down to Peru, and all the surgery instruments. Still can't get them back after 4.5 months. She sent them down to support Dr. Olson. We started Spay Peru, and Dr. Olson took a second year in Rome, taking a team of veterinarians down the Amazon, fixing animals, in the little river boats all up and down the Amazon. So that's kind of the problem. And recently I was in a meeting in Hermosillo with the officials in Hermosillo. We were doing a big campaign there, and one of the officials turned to me and he said, Craig, we have another problem here in Mexico, other than the problem of pet overpopulation. He said, we have a problem here called poverty. And it's very true. A lot of people down there can't even afford the gas to get their children to school, let alone this. So when when Byron was talking about the whole ramifications of this issue, it is a huge, huge problem, because a lot of people in these Latin American countries have to depend on vending in the streets, and now they basically just don't have a support system like maybe in the U.S. or other countries. So anyway, that's the the downside. Now, the upside of all of this is that it's given us time to reflect and think about going forward. How are we going to make a difference? And how are we going to approach things differently? So in our campaign that we just recently did, the teaching campaign, one day, it used to be 5 days of surgery training, because what we felt is, originally we felt like if we can, instead of giving the surgery away, if we can teach a vet how to do the surgery, then we'd pass the gift. So we try to keep it simple, have some fun, and pass the gift. And we just have been having conversations about the new way of passing this gift. And a lot of what we've learned over the years have it really increased our ability to do surgeries. One of the things I mentioned earlier was Dr. Mackey, who taught us quick spay. About 15 years ago, he went down with us and he started teaching us how to do a high-speed minimum invasive surgery. You get in, you get out. It's very sterile. We don't have the same rules like Byron had mentioned earlier. He's seen vets down there in Street Square doing surgeries. It's not the same down there as it is in the United States. United States is very clinical. You got to do an exam. You have to, most of the time it's on anesthesia, things like that. We use injectable anesthesia. And one of our surgeons, Dr. Caesar, down in Ensenada, was doing with his team, he was doing every weekend, all last year, the year before, and this year, upwards of 300 surgeries a weekend in the Tijuana, Rosarito, Northern Baja region. And that's just in 2 days. He's doing those amounts, those numbers. So again, it's different in Mexico. He's working with a lot of rescue organizations. Most of the shelters will have, any kind of organization that's looking for it will schedule him weeks, months in advance. So his whole year is typically scheduled, and that's all come to a screeching halt. But what we thought we could do now is passing the gift. We want to figure out a way to take our spay neuter training, which has been our focus now, is to teach them how to fish, right? To take that online and to do the best we can with that, which is to have, maybe even to the point where we have GoPro cameras up here and we're watching, we got 2 surgeons watching somebody, and have an experienced surgeon training in some other part of the world. And we'll try to do it virtually like that. The problem there is, if you have an emergency, yikes, how do you handle that? So there's a lot of issues we're going to have to learn. But the recent focus, there's two more things I want to finish up with. The recent focus for this project to win is to pass that gift. And so what we're doing now is we're getting a lot of little tips and tricks and how to do this, and how do we close? How do we make a minimum invasion? How do we use a spay hook? A lot of these things seem like, vets all know, but like Dr. Caesar did 2 spays and 2 neuters in 10 minutes. Okay, this isn't a master surgeon. He's done thousands and thousands of surgeries. Okay, so he really, we figured it between 800 and 1,000 surgeries, you really get good at it. And so the thing is that we have poverty and we have a pandemic, and we think that if we can teach veterinarians how to do a faster, less expensive version of the surgery and not jeopardize any safety whatsoever, then we're going to be on the right page. And I know that Byron and Karen are really focused on how do we keep the quality up, and how do we bridge, the gap from, just the emergency surgeries that we're doing now and create an environment where we connect the veterinarians as public service to the communities that they pull up, drop off the pet, don't touch anybody, don't compromise the team inside, the clinic. Then I think the business can increase. I think that we're going to get from that surgery that's not being done into where it's doing it. And one point I wanted to say about that is that one of our original veterinarians that was down in Mexicali, he said, Craig, I saw this video of Dr. Mackey doing a surgery, and he says, I increased my time by 50%. Now, that's cool. And I didn't say anything too much with Stacy about this before, but for years, Dr. Jeff Young has been trying to get us to track the surgeons, track the surgeries, all that stuff. So we put together a new application called Spay Global. Now, what that's all about is if we train somebody, we're going to take what we're going to do is we're going to put them on the map, just kind of like, Home Depot or Costco. Like if you guys want to know where there's a Home Depot, you put it in on the map, and there's 2 of them in your neighborhood, or there's a Costco close by. So that's what we've done. We have a new application now, and we're starting to get ready to roll that out completely. It was called spayglobal.org. And Dr. Jeff is Dr. Jeff Young with the Rocky Mountain Vet is the head of that. He's the chairman of the board. And we're just getting that final, but that we're going to utilize, that'll be a vehicle for, like Byron said, some of the clinics that decide they want to focus on spay neuter and be part of the solution, then they get on that map, and people can look them up on the map and they'll be directed to their clinic. And so anyway, we're working out the final details on that, but please take a look at that at spayglobal.org. And hey, I remain open to any questions that I might have missed.
Very good. Super.
Hey, there's our team. Hi, team.
Thank you guys for everything for these. So I have lots of questions. One question is, and I'll make sure I can pass this on to everybody, it's actually for Karen. Do you have SOPs written for your social distancing or any sort of the special protocols? And is that something you're willing, oopsie, I'm crashing the table here, willing to share? Or is that's what people are asking for it? I'll put it that way. Oh, you're muted, sorry. I'm gonna unmute you. All right. And everybody's unmuted now. Okay, sorry, Karen, go ahead.
Yes, I've had several requests for such SOPs, and absolutely in the next few days, I will have SOPs available for anybody who's interested in using them. Working with Bryan on that as well to make sure that they're disseminated as widely as possible.
Another comment, Danielle Bays, who everybody knows very, very well and is a frequent flyer at our pop-up panels here and also on the show and everything. Just wanted to remind folks that every state has different laws and the veterinary associations and specific rules, and so you have to make sure you check with your local licensing board to make sure that spay neuter is, it's at your discretion as to whether you're able to do that or not. So just make sure you have to check with your own locality with regards to that. All right. So I have a question about, big question. This is sort of a general one, but I'm going to start with Bryan on this one, and maybe Karen might also have some ideas. How can we encourage shelters that have clinics and that have offered services, or just even clinics in general? How can we encourage them to try and open up? So I'll go with Bryan first, and then if others want to chime in after.
Well, I think it comes down to trying to figure out why services are not being provided now. What are the specific concerns? As I say, I think there was a lot of knee-jerk reaction in the beginning and a lot of pressure from above to stop. And so I think there hasn't been a lot of critical thinking around this issue. And so I think we need to be respectful of other people's choices, but also to just ask, like, what is it that you're concerned about? Are you concerned about a lot of people in the lobby? Then there are ways we can address that. You know, are you worried about, you don't want, you know, having social distancing within the clinic? Well, we need to start looking at clinics that are operating and have continued to operate throughout and find out, well, how are they dealing with this? Is that something that you can apply? Really start asking ourselves, like, well, how much of a risk is it to fix the animals that are already in your shelter before you adopt them out? And also realize that we don't have to come back at full speed. Maybe they can handle 2 or 3 pregnant cats a week. Maybe they can only want to fix the animals that are they're adopting out. Whatever it is, whatever we can open up is going to mitigate the potential disaster, the potential 4 to 16 million new kittens and puppies that are going to be born if this goes on for a few months. So I would, you know, be respectful, ask what the concerns are, see if you can address them, and talk about just what can we do. Do we have to have this completely shut down, or can we begin to at least open it up a little bit?
And I would second that. Right. Danielle, it has made the good point that I think I also made, that you need to check your local restrictions. Is your shelter shut down because there was a mandate that was not an essential service, or was it this knee-jerk reaction? Our municipal shelter has stayed open. They are spaying and neutering as they adopt out animals. Yes, they have done a lot of mitigation practices that they've implemented with regard to, when you come to the door, you call and an individual will meet you at the door, and there will be social distancing in place. They're continuing to adopt out altered animals as we speak. Again, their adoption center is open with those social distancing procedures in place. They didn't close because there was no mandate to close. In fact, shelters and rescues, pet stores in our state are considered essential. So checking back to see what your rules are is important. And then, was this just an overreaction of something that made the shelter directors feel most comfortable at the moment? And now that we are in a different place, as we are every single day, could they look to reverse those decisions and take some of the skill sets or policies and procedures that those of us who have stayed open and use them to their advantage?
So, and if Craig, if you didn't have the issue with PPE in Mexico, do you think the clinics would be operating?
Oh, absolutely. Absolutely. They all want to be operating. They just can't get the supplies. They can't transfer. I can't even get them gloves over there. I mean, I have them, and, you know, they just cannot get the materials. We're working on it, though. So we're trying to come up with solutions.
I have another question. Do you think we should be considering more sort of strategically, like opening in areas of the country where the coronavirus hasn't been so bad? So maybe we're not opening in the New York area, but maybe we're opening in Wisconsin. Is that a possible solution?
Well, I think, yes, I mean, absolutely. I think that the circumstances that exist in the wherever you are going to be unique. And if you're not, you know, if you're in a county in South Dakota that has 0 COVID-19 cases, not a lot of risk of spread, I think that you still have to follow the same procedures, though. You still have to maintain social distancing. You can't just assume that there's no risk, and you have to continue to be, you know, act in a way that's responsible. But that may, look, this is all a balance risk. We're all balancing risk benefit here. And, you know, the benefit is that we avoid this catastrophe that has both huge implications both within the animal welfare world and without it. And we're weighing that against what is the risk of continuing to do spay neuter, or to do it in some degree And if the spread of the disease is minimal where you are and you maintain safe procedures, that may influence your decision about whether to go ahead or not. So, but I would also point out that, Neighborhood Cats operates in New York City, and the main spay neuter clinics have been shut down. The one that the ASPCA normally offers a free service to feral cats, community cats, they've closed. That's absolutely, got to respect their decision in that way. But we are finding veterinarians, there are veterinarians in New York City who are open, and we're working with them. So each veterinarian, each clinic has to do this balancing act and decide where they come down.
Right, excellent. One person actually asked just to share your names, and would you be willing to share your contact info?
Absolutely.
Oh, sure. Yeah,
Sure.
absolutely.
Craig, why don't we go with you first?
Craig at spaymexico.org.
Karen?
Karen at alleycatadvocates.org.
And Bryan?
Bryan with a Y, B-R-Y-A-N, at neighborhoodcats.org.
Financially, the clinic business models that Karen has to live by day with the revenues coming in, those are different. That business model is totally changing until we have a vaccine developed, in my opinion. That could be totally wrong, but I have a feeling we need to prepare ourselves for that kind of lifestyle until there's a vaccine that's administered, and whether you're an anti-vaxxer or whatever, I won't go down that road. But, so how are we gonna survive as clinics doing 8 to 10 cats a day when we've done, 25 to 30 a day in this new environment? So I don't know, Karen, if you can comment on that. Are you thinking about your future business plan and your business model, or do you feel like you're going to just return to normal in like 3 to 6 months?
Obviously, I don't have the crystal ball that could answer that for sure, but right now, with the government support with regard to unemployment, both the federal support and our state support, our furloughed employees are remaining whole. And as I increase the number of hours that they're asked to work, as the need increases and the revenue stream increases, they will shift from that government support, which is so gratifying that they've received it, to back being employees of ours full time. The challenge as a nonprofit organization who relies almost exclusively on private donations is that will those donations follow? And that's the crystal ball that I don't have, but I'm confident that the people in our community have embraced what we do, and they will continue to embrace what we do. While it's like looking at a scared cat in a trap, you hate doing this to them, but it's only 3 days in their life. And if this is only 3 days, 3 months or 6 months in our lives, the people have not transformed themselves into uncaring citizens. They're going to find a way to support the good work that they've supported in the past. And I'm confident that 3 to 6 months out, we'll be doing what we need to do to fulfill our mission in a community that has supported us for 20 years.
Yeah, I'd like to jump in on that, and because I'm on the board of a spay neuter clinic that is suffering, financial hardship by the complete, shutdown. And as you mentioned, Stacy, as things reopen, it's not going to be at the same volume. And I'd like to, point out that one of the things that the groups that are responsible for having pushed us as a field into this shutdown, one of the things that they're talking about is, well, you need to all stay safe because when this is all over, we're going to be coming, we're sitting around now and we're planning these giant this enormous amount of spay neuter funding is going to be coming your way like never before. And we're going to have these huge events and we're going to catch up very quickly. So I think that's a little bit of a utopian view of the current situation. And that'd be great if it comes true, but I don't think it will. I think we'll be dealing with this, as you say, for some time until there's a definitive resolution to the virus. In the meantime, a lot of spay neuter clinics are really struggling, and it will continue to struggle even as they open up to a lower volume. And I would urge those organizations that have funding, that are planning on this big bang, to hey, look at what's going on right now and use that funding now to support the clinics so that they're there for a big bang when this is all over, because right now a whole bunch of them will not be, and they're teetering on the edge of bankruptcy, and they need either direct grant support, or they need, as Craig mentioned, they need to be taught how to fish. They need to be given funds to buy an x-ray machine so that they can increase the services that they offer. They need to be able to do blood tests within their clinics so they can offer more wellness. They need to be able to diversify if that will bring in more revenue while we're waiting this out. And that funding that you're saving for the end, which may never come, needs to be put to use now.
Craig, I want to ask you a quick question that's on the same theme. When we're thinking about clinics and planning, so we have, we have our staff, we have our materials, we also have our time as a factor. And, with you and working with regards to the quick spay, maybe in a safe environment, we can still do 30 cats a day, but we're saving on our surgical time. I don't know the differences between the Humane Alliance teaching versus the quick spay teaching. I don't know those intricacies, but some of the time numbers you're talking about I could see some efficiencies happening there if we could have faster procedures.
First of all, we're very, very close with Humane Alliance. The only difference is the language. a lot of this is done in Spanish. So, but one of the things I wanted to say about this essential, non-essential, one of the templates that we ran into a bunch of years ago was from Costa Rica, the McKee Project. Christine Crawford down there created the cat condos outside the back of the hotels, and because the hotels had an overrunning cat population, so they fixed the cats. And instead of euthanizing them or getting rid of them, they found out if they did that, they ended up with a lot of rats. So they started the cat condo concept, and we're starting that along the Cancun region right now, and we started in Rosarito years ago. It was a very cool project. But what happened, I mentioned earlier that vet, that watched Dr. Mackey's tape and increased his speed. He became very, very successful because all of a sudden he was offering something that a lot of the community needed. They needed a low cost place where they could get surgery done. And he's still doing really well, he was. But the thing is this to me, this is a bridge opportunity for veterinarians. And Spay Mexico is about all veterinarians. Without the veterinarians, we can't get the surgery done. So we really focus on the vets. The vets is being the key to solving this problem. Emily Kane was a veterinarian from Arizona, and they had a big billboard said, "Hug a vet, the other family doctor." And I just love that. It was just wonderful, because the vets, without the vets, we've had to really go through a lot of changes to keep the vets at the table throughout the years. And the bottom line is, if you get a humaniac vet that really wants to be part of the solution, we want them on the map, because the bottom line is they'll make it work. They'll bridge their gap from the emergency clinic, just doing emergencies right now, to if they can create a spay neuter, half a day spay neuter only on Wednesdays and Saturdays or something like that. And that's how a lot of ours do it. And then the other thing that happens is we went to Tomahawk Trap, and we got a whole bunch of traps, and we sent them all over. And the vets love it, because they give them to these little ladies that go out in the middle of the night. They trap these cats, and they bring them in, and they set them in front of their clinic, and it's beautiful. It's a real solution. And they get a little business out of the deal, and a lot of them they just do for no charge because they're humaniac vets, But the idea is that it's so funny. We were on our way down, and we stopped in at Mexico City on our way down to Santiago here a while back, and we were going down there. The government brought our team down to train their vets because they passed the rules saying, hey, we're going to do spay neuter instead of kill our animals. In the middle of the night on the way in Mexico City, our surgeons took a taxi down to a big hospital. It had 700 cats surrounding this hospital. And this Sandra with Gatos Pingos was down there all night trapping cats and fixing them. These guys were exhausted. In the morning they came back. But that's the coolest thing. You get these humaniac vets that want to go down the Amazon. They want the voyage of solving the problem. And that's what we're looking for. We're looking for those guys that have it in their heart to solve this problem. And that's the beautiful thing about the whole pandemic thing. I think whenever something really hard comes along in our life, something really cool can happen from it, and we'll rewrite the manual on how to get the solution going. So I'm optimistic about it.
Greg, thank you. That's a great way to close out. Unless does Bryan, Karen, you guys have any last minute comments?
No, I'm good.
Yep, no, I'm good. Thank you, Stacy.
So
Thanks, Stacy.
Craig, thank you. I want to thank our panelists today for sharing their thoughts and their ideas. Really appreciate it. We are going to be back here again at 4 o'clock Eastern time on Monday with another panel. I know I've scheduled that from 4 to 5 p.m. I can tell you that's going to go longer than an hour already. I know that, knowing the speakers. So, so plan on at least till 5:30 on that one. I'll extend the webinar window for that one. But at 4 o'clock on Monday, if you haven't signed up for it already, please go to communitycatspodcast.com, the website. You can sign up. The link is there. I'm going to be continuing these spay neuter panels through the next weekend, so I'm going to be scheduling more panelists. If folks have someone that they'd like me to reach out to present, to find out what their ideas are around this issue, feel free to send them my way, and I'm happy to also nudge emails and encourage folks to join in. This is open door. Everybody's welcome to join us to listen and hear. We'll probably have this pop-up panel posted on YouTube, in several days. Kristen is the boss in that one, so she'll work to get this up onto YouTube so people can see it, and we'll share it around. I want to thank everybody again, and I hope everyone has a great rest of the weekend, and I'll see you all on Monday. Thank you, everybody.
Bye-bye. It's been a pleasure.
Bye. Bye.
Bye.